Testicular Cancer Awareness Month. While early detection is key for any cancer, this one doesn't have a set screening or test. KTIV's Claire Bradshaw shares more on what a local oncologist recommends when it comes to cancer.
It's time for men to be aware of what's going on down there. Testicular cancer is the most common cancer for men in their 20s and 30s, according to Dr. Nabash Budatoki. But it can strike at any age. That's why he wants men to keep a careful eye on their bodies.
A painless swelling in the testis or even a painful swelling. Some patient can have gynecomastia, meaning enlarged breast or painful breast. Some people can have infertility, and if the cancer is advanced, then patient will have symptoms related to it. For example, if it is in the abdomen, they can have pain.
He says it's simple to check. You can just do so in the shower. If there's a mass or anything abnormal in the nether regions, call your doctor.
Even though this is highly curable cancer, if we actually diagnose it very early in stage 1, then we might be able to do away with chemotherapy, and even chemotherapy and radiation and surgery is curative if it is very early stage. So I would strongly advise people, men, to go and seek medical attention if they notice some mass in the testicular region.
The Testicular Cancer Awareness Foundation says the cancer is over 95% curable, but every hour a man is diagnosed. Claire Bradshaw, KTIV News 4.